Hey everyone, it's me, Dr. Jason, and today we are here for World Heart Day. Today is 29th of September, Sunday, and we are actually on live 6:30 p.m. Dubai time, 8 p.m. Indian time. We are actually live. If you are watching YouTube, we are also alive now in Instagram. So, if you guys are not following me, or if you want to share, if you want friends to share this and send them this link, actually Dr. Jason's link, and tell them to watch. I'm just going to hold on actually for next 30 seconds, 1 minute, 2 minutes, just to start with the intro. And again, anyway, this video, I'm not going to wait for all of them to come because this video will be posted. Today's important point is very important because you need to love your heart. If you can love your heart, hopefully you can live well. So, why we are here for this big workshop? Actually, today, if you're going to watch this workshop, you will take away an unbelievable information which you may not even had in your whole life. So, I just wanted to tell you something very important. Recently, I just was traveling with actor Mohanlal. And that's a video probably if you go to Dr. Jason's Instagram page, and we were traveling, and it's actually we also put that as a video as his birthday. But most important, I was traveling after a movie shoot from Trivandrum. So I am originally from Kerala, and most important thing is actually, so we are Keralites, and we have dhotis, and we don't know when the big belly comes, and we can just still go around, and we always as Indians we use saris, so we don't know how the waist increases, and you know that when your waist increases, you have a high chance to have heart disease. Now, my story, I was with actor Mohanlal, and I was sitting. Normally, I believe 20 years back, I was shooting for another movie with Mohanlal sir, and I traveled from Trivandrum to Ernakulam, and Ernakulam to, accidentally we had to go to the other side, almost the border. So literally I traveled Kerala that particular day and 20 years back. So I just remembered in 20 years back, my remembrance was actually literally, I seen every probably maybe a 1 kilometer or 5 kilometer. Yes, there was less of flex and everything, but still we could see some of them, that pictures of old people, yeah, very old people, maybe in 60s and 70s, and the pictures. And yeah, it's a normal thing. Actually, people are aging and dying, and very few people, probably like an accidental cases or everything, you will see. But like last year, when I was traveling actually from Trivandrum to this side with Lal sir, I was looking at it, and every junction, probably every half a kilometer, 1 kilometer, every junction, I would see pictures of youngsters, probably in 30s and 40s and not even 50s. Even I saw many young kids, and even they put that 28, and I was just shocked. And I wanted to find out actually. So I put 2-3 of my trainers. I have few trainers. Actually, I had around 15-20 gyms in Kerala. So we had still a lot of good trainers, Sanish and Vivek and Raju, and so many of them. So I employed them to find out and how these people are, they had this, why they died. And you won't believe it. Most of the youngsters, maybe out of 100, probably we got gathered the data, at least 90 plus had a heart attack or similar, on accelerated heart attack. I tell you what it is, or maybe 5 to 10 of them was probably maybe by an accident or certain reasons. So 90% that youngsters had the heart disease means is quite alarming. So, if you're watching this video, guys, please to share to your friends and your family. Heart disease is now, it's very common in youngsters. So, once again, it's me, Dr. Jason, and today is 29th of September. We are on live in Instagram and YouTube. Today is World Heart Day. So, I thought when I was in the story, if you watched, heard my story, I wanted to have an amazing, I wanted to pass every single person, whoever comes to me, and I will clearly tell them, brother, if you have to take some action, do it today. It's not like before, 10 years, 20 years. And your heart is very important. One of the heart is only you have, am I right? So you have one heart. You don't have two heart to play around. Am I right? You have just one heart. You have two kidneys to play around, but you don't have two hearts to play around. And when you get a heart, when your heart is stopped, you die. And that guy, from you born till you die, it worked for you. And how much, like the things that you are doing, you are eating wrong and you're smoking, you killing that guy, that only one guy is starting the work. When you sleep, 24 hours is employed, and imagine he is actually, taken care. That is why, guys, today's world, after the pandemic, it is quite alarming. And I just wanted to tell you, I want a couple more stories before many of you join. Actually, my neighborhood boy, I used to carry this boy. When my mom died last year, and I think he was abroad, he was literally a young guy. I saw him and probably in 30s, and it was shocking actually. He came and he was in the funeral, and literally after 3 or 4 weeks, I heard that this boy had a heart disease. And I remembered I told him actually he was actually having a belly fat. And I will talk about that regarding the overweight. Another boy actually I met, and that's a similar thing, around 30, 36. He was very thin. So one person actually was very fat and the other guy is very thin, and both of them had heart disease. Imagine. And why? Why this one person is overweight? Okay, some people say because you're fat, maybe you got it, but the other person is having heart attack. Now listen to me. Today, if you are here in this seminar, in the workshop about your heart health, I am not going to give you a medical research and this and that. It's a very simple story, and I just wanted to pass a message. What I have learned through years in my health and fitness and wellness field, I'm just going to share it with you. It's not that like the other medical doctors come and do your HDL and LDL, you do this and that. This is not, we are not. If you are there to listen that, I am not here for that. I'm going to make it very simple, a common man's language. We call it a layman's language. I'm a layman. I'm not an advanced doctor. I'm not a cardiologist. I'm a very simple person that I want to educate every single person that how important is your health. And when you live, how you can live well. If you live to 100, you live happy, healthy, and die healthy. That's this year's book for you I am going to come with. So most important thing is today's topic. Again, I'm going back to the story. I told you about the Monlal story and my neighborhood story. And I have seen actually another one. My Abhilash is one of my employee. And I remembered from last December till today, Abhilash is actually scared, and Abhilash came to me last week, and he's one of my mentor, and he has diabetic, and he's severely diabetic, and I have given him earlier, but he has a bad habit. I can't give you. Sometimes you go back to the bad habit, and he again accelerates his sugar level. Now he's on back into the mode, and he said, "Doc, I have almost 7 of my classmates died in." This one person died in an accident, and 6 of them died. And he's into early 40s, 40, 41, 42. Imagine Abhilash, no, because his classmates, because some of the classmates in schools and college, they in that, and 6 of them, they gone in early 40s, man. It's unbelievable. And what? Most of them, some of them, they're drinking, or maybe they're not that too fat or overweight because of the lifestyle. I will explain to you all that in a later on stage. So, guys, if you are there, don't think that I'm 25 and 30 and 35. Even young kids are having. I will explain to you all this. And again, one of the major reasons for this is actually, as I said, as a layman's language, I would say, one of the reasons is actually pandemic. Pandemic is what? Recently one of the big companies who made this I don't want to mention the brand name, they acknowledged, they said that, yes, we had a mistake. And these vaccines you have taken actually can accelerate the heart disease. Which is incredible, guys. Something that we have taken and it's go into your body as a chemical, and actually to prevent a bacteria, you ingested something in to block it, and that is actually literally clogging your arteries. I'll show you with that. Getting literally blocking your arteries. That's your arteries, means your pipe. And I will explain to you what happened in the pandemic. The pandemic reasons, because of the fact I will explain to you, and again, what is the reasons. You need to see this pipe. Now, in the olden days, our arteries used to be very fragile like this, which means it's flexible like this. As soon as you got the medicine, what happened? Again, I think in a couple of times I have explained to you, it went like this, and you can see literally, as a layman's language, it's become stiff. It cannot anymore flex. So you have, the heart is actually a powerful organ, and your heart is trying to pump the blood into the arteries in the olden days. So what actually done is, if you have an extra weight, probably if you only had 5 kg or 10 kg, now even if you have if genetically you are putting some of the fat inside and cholesterol or the plague, what happened is, in the olden days, probably you put on a lot of weight maybe, but now after the pandemic, the medicines actually, not helping the arteries to be more on agile or flexible. What is happening basically, literally, it is actually accelerating the block. And I will explain VLDL and HDL and LDL story little later if you stay with me. So this is one of the reason actually people are getting high number of heart disease, and it is actually acknowledged by these companies. You believe the people who made the medicine, they acknowledge, yes, it is happening. So it is not your problem. Now you need to take an action against it, otherwise you will be one of the victim. Do you want to be one of the victim like that? In your young age, you made everything. You're a successful person, and you just wanted to get, okay, dying is fine. Many people comes to me, Dr. Jaison, one day we have to die. I am not asking you, even me. There is no actually guarantee in life that we can live 100 years. Am I right? The idea is, imagine, I tell many people this story. I have seen, I don't want to mention it, but I have seen at least a handful of people who came to me, and they snobbishly, we call it snobbish, we call it French people, they are snobbish. Snobbish means their neck is high. And they say, okay, like that. I've seen the many people like that. They came and say, hey, it's okay, we have to do anyway one. And certainly some people, religiously, they also say that, anyway, we have to die. Look at the, dying is fine. I have seen these people, out of them, at least a handful of people, they have got stroke and bedridden for average 2 to 12 years. And one person I know recently, last week, died, and he was bedridden for 12 years. Just a negligence of, I don't want to mention, I'm not saying something. One of the reasons it could be that severe diabetic patient, ignorance, taken him for a stroke, bedridden, inactivity, suffering for 12 years in the bed. Which is not good, guys. We can prevent it. We can prolong it. We can enjoy the quality of the life. Okay, so let us conclude that regarding, so you have an idea as a layman's language why it is very important for you to take an action today. So stay tuned with me till the end of this workshop, and you take home a lot of amazing information. Hopefully it can prevent you, or your friends or your family can improve your overall health. So I just wanted to tell you something about as basically an average person like before. It's not like the same as someone with probably even in 25 or 30 they have this heart disease, the higher chance. So take some action. And now many people comes to me, and the other day one person came, and I just wanted to put this slide. Imagine some people say, oh, I put on weight and I have gained some fat these days. And why is it important when you get overweight? Why it damage the heart and it accelerate the heart disease according to your genetic and DNA? So why it accelerate based on your genetic? I wanted to tell you some simple thing. Many of the trainers out there, health practitioners out there, many of the people, I don't think they know this secret. When you're born, you have, say an example, 100,000 fat cells. When you die, you have 100,000 fat cells. So how do you increase the weight? Literally, the fat cells is increasing, not the number of the cells. Do you believe that? Many of the people comes to me and say that I put on gain weight. They think that they put on new fat cells. No. So it's your gene. Imagine you're getting married and you're fat, or if you're overweight and you're carrying all these genes to your family. You understand? It is not good for you. You're making a generation of people unhealthy. And you are the one of the person actually, the future's people, you are what you're doing. So I want you to take an action, and that extra weight accelerate. Yes, you got something, you got that gene. So make sure that you reduce the weight, reduce the size of the fat cell, and increase your health. I'll explain to you later, but it's very important. And then I've seen with the people who is actually having external weight doesn't have any health risk, if you say. But as soon as you put that weight back inside, that is the health risk. And you want to know, and I will explain to you what is the toffee is later. So that is, in the olden days, if someone was carrying extra 5 or 10 kg, now it is even 5 kg extra internally, it can give you a heart attack, because I told you that actually the fat is literally clogging with the medicine is affecting double. So you have to be very careful with that. Now, many of the people comes with me and say, I'm diabetic and hypertension. I just want to reduce the belly, and that's all I need. And you don't believe it. They are just casually say, I'm controlled with my medicine. What is they controlled? Heart is a like a motor. How can you control? It's not. You cannot take a diabetic medicine, hypertension or fatty liver, obese. There's no medicine for even fatty liver, guys. If you have a fatty liver, you have a higher chance to have a heart disease, and I'll explain to you that. And many of the women have hormonal issues, and hormonal issues what, like thyroid and PCOD. And PCOD is what I had literally a lady, a girl, and that girl even don't have any clue what is PCOD is. And her father is taking a medicine, and she buys the medicine of her father, and herself is the same. She's only 20. She's not diabetic, prescribed by a doctor, and they just not even educated. They don't even thinking PCOD, a hormonal issue. Her menstrual cycle is not normal. Doctor prescribed the medicine for her father, diabetic medicine, and her the diabetic medicine. And I had to educate her. My friend, what did you study? I said, master graduate. Think about it. Why you have to take a birth control pills? And she wants to get married. She came with her fiancé, and I said, look at you. You are doing two things. One is, you have blood sugar spiking into the bloodstream. That is, the sugar is spiking. Same with your dad is the same thing, and you need to take medicine to reduce your sugar. So you're like a diabetic. And the same thing, she has severely fatty liver. She has a belly fat. Most of the women, with the girls with the PCOD, I've seen it, they have a severe fatty liver. That's one of the reasons they put on weight. And the doctors, they give the medicine, then they never lose weight. Guys, if you want to lose weight, if you have a PCOD, thyroid, any lifestyle diseases, Dr. Jaison learned something naturally as a layman, not medically this, that. I'm telling you the simple solutions we have. We are living in the planet with an artificial intelligence. When I wanted to search for this seminar, I put AI, artificial intelligence. I'm telling you the truth. But I wouldn't find all this information what I wanted. And then I learned this artificial intelligence is, yes, it's good. But for me, what I learned from the knowledge from the people to people for the last 40 years is extremely different to a chat GPT or AI. Do you understand? The informations are extremely different. But we have technologies, that's what I wanted to tell you. It's the modern technologies and simple solutions that can clear it. And we are advanced with it. And I will explain to you. So PCOD and diabetics and all these lifestyle diseases, including blood pressure, and this accelerate the heart disease. If you are diabetic, you have tenfold more to have a heart attack or a stroke. And medicines, if you're taking a medicine, is actually what? Only it's literally, reducing the blood sugar. But again, later on, the doctor has to prescribe you 10 mg, then 20 mg, then insulin. Then they might even ask you for a Manjaro or Ozempic. So many the new technology, but it's again new medicines, guys. I'm not a fan of it. I need to move on. This seminar, I may not be able to continue for a longer time because you may get bored. So I'm just moving on. I will come up with a bigger workshop and I will tell you more about this. Now, next one is why we are all actually, what's happening with our body is why we are getting heart attack and the other diseases. Basically, we call it something called a glycation. And I can't give you on all the information what is glycation is. Glycation is what actually sugar joins with the fat or a protein and is a harmful process happen. Literally in my layman's language, I say, when you eat sugar, when you are become fat, when you are diabetic, when you get a pollution, when you get a free radical, when you smoke, when you're overweight, your body is cooking faster. You enjoy a sweet, your body is cooking faster. It's like that you're standing in the fire and you're cooking your cells and your body and you're damaging your body. That's exactly same effect on your body every single day. Increasing your weight also is happening. We call it a glycation. That glycation is making you age. I don't want to mention it, but most people knows that I'm actually 50 plus. So I learned one numbers, 5, 7, 9. Two things I learned in my life. I can't give you that information, what is 5, 7, and 9. And second, I'll do less of a glycation, then you can look younger and live younger and healthier. So the more the body is glycated, as I said today, you come to my bigger workshop, hopefully you may learn all the glycation and what is the number 5, 7, and 9. When you reach the 5, if you reach that below 5, that number I'm talking about, do you want to give a clue? Okay, I don't want to keep it, because you are my follower. Follow me and just follow to 10 people. It's called that number 5 I'm talking about is HbA1c, hemoglobin A1c test. I can't give you all the information. That I give you a clue and find out. The number 5, if you're below, you are reversed your age, guys. Whatever your age you are. And I will tell you the secret when you come to my big workshop, and I'll explain to you how we can reverse your age. So probably whenever I look younger, below 50, probably that means I am less glycated and my numbers probably below 5. More secrets I can't give you and I will tell you. And the more free radicals increase with the pollution, with the food, the wrong food, and the more chemicals in the food and all accelerate the diseases. All you know that I'm not going to spend that time on here. Now, many people take medicines for lifestyle diseases, and like an example, blood thinners. Now, someone with a cholesterol and they're clogging the arteries, and the pipe is clogged, and like this, and there is only a small gap. When the doctor give a medicine for a blood thinning, what happens is in the morning they take it and the blood thinnen, and the blood, because the blood is so thick, and this goes into the pipe like this. You save for a few days. The day when you wake up, you don't take the medicine, and the blood is still thick, and the pipe is clogged, only a little gap is there. What will happen as a layman? This will be also not passing through. You're not getting enough oxygen to your brain. And what will happen? This pipe will increase the pressure and it will break. It's a very simple. So what do you need to do? You just need to remove this. What does that mean? Losing some weight and removing that cholesterol and fat. And cholesterol is a bad guy? Cholesterol is a good guy. Is it 200 is too high? No. Stay tuned till end of this video, man. I am going to tell you unbelievable break that is you never even had from your medical doctor. I'm sorry to say. In probably like 25, 30 years back when I was in London, I was privileged to be in London at the age of 20 and studying in London and America, privileged because of some of the royal families I worked. And I learned that time, one of the best doctor told me the cholesterol is 300 is good. Now when I go to a doctor, 199, you are on the border. You're going to be dying tomorrow. No, guys. But I tell you, if you're there, I will tell you what is numbers you need to know. Stay tuned till end of the video and I'll tell you the secret. Now, most important thing is the heart attack. That's the same thing I'm explaining to you. When your heart is pumping the blood and the fat is accumulating in your arteries, you getting the heart blocked and it's severely attacking, and it's called as a heart attack. This everyone knows, it's layman's language I'm explaining to you. Now many people do it when they have a diabetics, cholesterol, BP, and everything. They say, oh my God, all right, let's start an exercise, and they go for exercise. They put the hat on, they put the mirror on, and okay, let's go for walking. And the first thing, they get easy and free because they don't want to spend some money, and they just go for walking. Or when they go to the gym, they look at the gym, which gym has the most treadmills, and they will just walking for 30 minutes and 1 hour, and they think that they are into the business. I walked 5 kilometers every day, or 5 kilometers per hour, half an hour every day. Now I'm the healthy, I'm Superman. Sorry guys, I'm sorry to tell you, this is not health, that is not exercise. And one thing I want to tell you also about exercise, before I get to at least somebody is doing something is better than not doing anything. Why I mention here is, I want you to learn today the right, if you're putting the right kind of exercise and food. That's what Dr. Jaison, genetically gut-based and his blood type based, and the program precisely for conditions, they make it and we do it. And here, now most important thing is, I just wanted to tell you about exercise. Exercise is very important, but what level, high intensity, which I'll explain to you. But an example I tell you, the person who is in exercise, let's say we have a heart, need to improve the heart health. A person is overweight. Like yesterday I was looking at my friend or my employee, Mr. Shihab, is doing workout, and he's overweight, and we couldn't do his insurance actually because he's overweight. And my accountant said we have to pay more and all, and I said, Shihab, you don't have any other choice, you have to go and exercise. Shihab is overweight, maybe 30-40 kg, and I have a thin employee, is Basil. He's very thin. And Basil think that he is more healthy because I don't have time, I'm on a normal weight. Shihab will outlive than Basil because he's doing exercise. So it's nothing to do with your overweight. The day you start exercise, whether you are not overweight or not overweight, Basil is thinking that he is only 70 kg and his ideal weight, but Shihab started exercise, is 50 kg more. He will have more cardiovascular efficiency because he is doing exercise. Same with, I have a guy, I don't want to mention that person, that guy comes to my club, he's a smoker. And the smoker who is exercising, and the guy who's in ideal weight, like say an example, Basil is not exercising. Basil is an example of ideal weight, and Basil is not exercising. The guy who's smoking, he will have more cardiovascular efficiency than Basil because he's not doing anything. But that means somebody can smoke, and because that is not good for the lungs. Example I'm giving you. I hope you understand the message. Now, very important, if you have a friend or family or trainer, whoever trains you, just take this message. Just walking itself is not enough for your heart, because heart is very important. Heart is like what, if you, like an example, when my son had something, I didn't want to share it, but many of the stories I've told, I was and tested in my life many times. I'm still keep on testing. I'm sitting here, I reach some stages in my life every now and then, and today also I'm tested. Tested means a lot of challenges, including my youngest son had a big challenge, 3-4 years. We can talk about later, something about the brain and all. So that particular time I put on weight, and I started drinking some of the alcohol, 1 or 2 peg. I got fatty liver and I had to lose weight. Then I learned some way how I can drink, what drink I can have. If you want to know that, I teach you how to drink, and it's not disturb your blood sugar. I have the thing. If you want to come and join in my program, personally I teach you, not publicly. I can't teach you this. But most important thing is here, what I learned is actually when we reverse your fatty liver, and when I become normal health, when I drink that alcohol, when I drink that 1 or 2 peg, or that one shot, maybe 50 ml, and that become 200 and 150 and 200, or when I drink 1 beer, it become 2 and 3, then my body get adapt to it. The same thing with exercise. When you walk every day, half an hour, 5 kilometers per hour, when your stamina increases, your heart rate falls down. We call it resting heart rate. So we have 3 different heart rates. One is systolic, that's the power of the motor, and this diastolic, in layman's language, I'll tell you. So the heart is a motor. The power of the motor is 3 HP. That's the power is systolic. And the number 2 is diastolic. That's the flexibility of the heart. And number 3 is actually the resting heart rate. So let me continue and explain to you that. So once again, I'm just literally telling you, when your body get adapt to it, the heart get adapt to it, your stamina increases, and the resting heart rate, which I said systolic and diastolic. Diastolic is the elasticity and the systolic is the motor power, and the resting heart rate is how many times the heart has to beat. An example like it, I have a lower resting heart rate. Now what does that means is actually I sometimes have below 50. So my heart is only beating 40 years. I'm exercising almost every day. So my resting heart rate went below 50. Now I heard that Mr. Jaison Bolt, the runner, the athlete, the 100 meters fastest world record holder, actually he has a resting heart rate of below 30, which means such a big guy who is almost 7 feet, and his heart is only beating 30 times, or Dr. Jaison's heart is beating only 50 times, and 90 plus kg is getting enough blood and oxygen to the brain even, which means your heart is more efficient. And how do we achieve it? Through exercise. 40 years, Jaison Bolt went to the gym and exercised, and 4 hours, 5 hours, he constructed his motor. So he has such a big motor, and he has like a 10. His capacity of his motor is 10, and Dr. Jaison has 6 or 7. And somebody is not doing anything 1 HP motor. You understand? So as a layman, you need to increase the size and capacity, and I want you to have a bigger pipes. So if you have a bigger pipes and you have a bigger motor, this fat even go inside, it cannot. If you go here, it's stuck. If you have a bigger motor, whatever the cholesterol and fat is not going to do anything for you. You understand, I hope, as a layman's language. It's a very simple thing. Now, going back to the stamina, the resting heart rate is very important. Most of the people are inactive, like Basil. I checked Basil's resting heart rate is actually 90. When she have exercise sometime, his resting heart rate will fall down. That is one of the factors, and I'll explain Basil and Shihab one more time. Now, when your body get adapt to it, another thing. Now, the same thing what I was talking about my alcohol drinking, when your body get adapt to it, so your resting heart rate fall down, you are exercising, there is a theory. That theory is very important for someone doing exercise. That's I'm a member of an American College of Sports Medicine. So they taught me like years back, it was 220 minus your age, 65 to 80. But today, the precise theory, if you're a medical professional, I got this information recently, that number is 206.6. So 206.6, which means I am taking it as 207 minus your age. So let's say I'm 50 and my maximum heart rate is 157. 27 minus 150 is 157, and that's 90% up to that. It's you can go up, and so 110, 120, 130 when you do it, and when you have to do it all also very important, because I will explain that part. When you're just going for a walking, body is not, if you're just going for a walking, literally, when you wake up in the morning, you don't have any protein, you just go and just walk, and if you're walking 30 minutes, people say in olden days, me also as a trainer, I say, wake up in the morning, just go for exercise, empty your stomach. Empty stomach, you're walking, and you may actually literally liquidifying your muscle and water. Literally, you're not touching your fat. Your body to take only 4 minutes to liquidifying your muscle and water. It take 4 hours to touch your fat. So if you're walking half an hour, guys, you're not losing actually belly fat, you are only losing water and muscle. That's why many of the people just who walk in the street, you see the same belly, or people go to the gym, they without a goal, not doing resistance exercise, just doing cardio, they're still keeping the belly, big belly. And I told you earlier that every single person has same number of cells by the time of birth and when he died. Do you understand? So very important. All these things in my big workshop, if you come, and I will explain to you why it's important, what is the heart rate work, how it works, what is the measure, what is 65, what's the number. We can do, when you don't need to count, if you don't know how to count, you just literally do an exercise like that. Like an example, one of my trainer, he sprints. Okay. When I see him, he sprints, And that's a sprint. You should be able to, even while after, you should be able to say 1, 2, 3, 4, 5. That is actually the most important thing. Not, you should not be out of breath. That kind of exercise, if you are a trainer, if you somebody else exercise, if you're teaching somebody, if you're father, everybody has a different level. That kind of only that. You should not be in running and you're not able to do that is not good for the heart. So be careful. Somebody overloading, and many people, you've seen them, they're fainting. That's one of the reason, overloading the heart. Nothing more than 207 minus your age, 65 to 85% of the maximum heart rate. That is very important. Steady state, you need to do it. That's the best way to keep on heart improvement. And I'll tell you again one more time in my long workshop, and when you finish the workshop, you're going to take more information. Now, going back to the basil, I call him a toffee. What is toffee is basil? Basil is thin. Why I mentioned about basil earlier, basil is a thin guy, and he eats everything, and doesn't matter, his stomach doesn't get out, and Shihab eat anything, Shihab become big guy. And they both, and almost every day they buy biryanis, I've seen, and basil never gain weight, and within 1 month, Shihab will increase 5 to 10 kg. The same food. What happens is actually basil is toffee, and basil has more risk because toffee is what? Thin outside and fat inside. And that is more dangerous. Now this is Shihab. Shihab has a big belly. 80% of his fat is more on external, whereas basil has an belly fat is going inside, and he's complained that last week with certain higher risk of having probably a uric acid, and he's a fatty liver, certain things he is complaining because he's a toffee, he's putting more fat internally than the Shihab. So people think that, oh, I am an ideal weight. That's what I was saying. When basil is a thin guy, he's not exercising, Shihab is exercising, he is going to outlive him than the person who is a normal weight. So you need to exercise. Whether you are an ideal weight, exercise has to be important, and it has to be the right kind of exercise according to your heart rate. 207 minus your age, 65 to 85% of maintenance of at least 30 minutes, 5 times a week is as a minimum as a 2-1. So you have 30, at least the 5 blocks of minimum cardiovascular exercise you need to do it. And there should be also incorporation of resistance or weight training exercise. All this you can learn when you walk into one of our places. Now, let me conclude. Next 15 minutes, we need to conclude. So, the food is very important, and many people say, oh, this Shihab. Now, I asked Shihab to eat fat, to lose fat. Now, you might be thinking that I am a crazy guy. Why? This guy, many people telling me, oh, I'm burning 150 calories. Put the, the lower calories. You don't eat fat. You just eat. It doesn't work like that. What you eat and the number of calories, then when your body get adapted to it, that 500 calories, 1000 calories, it's not going to help it. You need to have a lifestyle modification according to your blood type, according to your genetic DNA, according to your gut. What is your gut? Gut is your second brain. If you don't see my videos, 2022, Dr. Jaison have done. Mohanlal is saying, what is gut? And that video also you can see in Dr. Jaison's, and if you just look at it, Dr. Jaison is spelled with a DRJAISONS. So you follow me and you see in 2022, I have done 365 days gut video. What is gut? Mohanlal sir is asking, Dr. Jaison, what is gut? Gut is your second brain. You have 70 trillion bacteria, 85% is good, 15% bad. Maintain them, you lose weight, improve your heart health, everything. And 365 days I have talked about the gut, how I can talk about the organ that is living. When you live and it start working till you die, it working. How we may need at least all my life to explain. Not even one. If I have to talk about gut 1 year, it will take more than 1 year to at least give you some information about the heart. So we are talking about fat. Fat is a good guy, and eggs are good, and many people throw out the yellow. Still, I met many doctors, including last week, I met 2 doctors. They're just nicely saying, because I'm sorry, when I went to the medical university, and I don't want to explain about my medical degree. I'm not medically qualified. I'm only nutrition. I am only a food and exercise doctor. I am practicing. Hopefully one day I will have that NBBS certificate just to show you. But most important, when in medical schools, when I looked at it, they only teach you just 1 day, 12 or 14 hours of diet and food explanation. So I'm sorry that doctors are not taught. It's a medical science, and that syllabus, it's only teaching them very less. And you are learning only the medicine. You're not learning anything about the food. We cannot blame doctors, the health professionals, because they just need to practice. And if you don't write a medicine and go, and I used to remember my relatives when they go to a doctor's and they say, I went to this doctor, he didn't write any medicine, and I went to the other doctor, he got me all the medicine for my neck pain, back pain, and this pain and that pain. I'm taking 3 Panadol and I'm okay now. Guys, if you take a Panadol 2 or 3 and that makes you a hole in your intestine. That's what my London doctor, Dr. Blair, told me. And he was an 80-year-old, and he checked you all over. And these days, none of the doctors don't have time because they watch a lot of patients and they themselves are stressed. I even in Instagram, I put a video of a medical doctor, a pathologist, and he was smoking. He's literally younger to me, and he looked old, more than 60 plus. And he was just literally standing, and I was doing my work in Bangalore last week, and I put that story in Instagram, and I said, as a lead by example, like me, I don't smoke. Okay, I drink a couple of times a week, maybe a glass of wine, but that's different. When you smoke, we cannot reverse it. Am I right? Your liver, you can reverse it. Even if you die at almost, even the last stages of fibrosis, we're not in cirrhosis. And grade 1, grade 2 and cirrhosis, fibrosis and cirrhosis, if you're not in the cirrhosis stage, we can still revive it. You understand? So most important thing is, the medical doctor, he was an example, and he was smoking in front of me, and he was just justifying me that he's stressed and blah, and that doesn't work, guys. So understand. So very important for you. You need to take care of yourself. The person who's supposed to lead you and he's a smoker, then how are you going to improve your health? Now, I don't want to sort of that's all everybody's priorities, but an example I'm telling you. You're the only one person in your life can save you, not Dr. Jaison or a medical doctor. You take an action and you get the benefit. And today I had a lady came to one of my manager and said, I went to Dr. Jaison's clinic, and I went there, and the consultant doctor said, okay, I'll take 2 sessions and blah. And she's overweight, 30-40 kg. And she's complaining and coming back, and after 2 months and saying, nobody followed up with me, and that's why I couldn't come back. And says she's overweight, she has diabetic, cholesterol, fatty liver. She's supposed to take an action. She's trying to blame someone that nobody called me, that's why I didn't come. It's not the consultant health. It's not my health. It's your health. You should take an action, not me. Am I right? Sorry to say that many of people that they just think that it's we just come in front of you and say, we have to do something for you. Nothing. Nobody is going to do anything. Your parents, your mother, your father, your relatives, your wife, anyone, nobody is going to do. You're the culprit, whatever you are making it. And you have the switch to turn it on or turn it off. That's your call. So I'm going back to again, the fat won't make you fat. Eggs you can eat. If you're a man, that 3 eggs, whole eggs. If you're not eating too much of any other food, cholesterol, fried food, you can eat whole 3 eggs every day. And it's nothing to do with that. 3S is the culprit for your heart attack to every disease. And I'll tell you on the next page if you stay tuned. So if you're eating a lot of veggies and protein, that's fine, but this 3S's is actually the culprit for any kind of disease. Guys, that is what you need to know. So if you are eating fat, coconut oil, butter, ghee, olive oil, virgin coconut oil, cold press, if you're eating nuts, seeds, and all that is fat, and all are extremely good for you. So fat won't make you fat. Even I want to tell you this secret. Many people, if you're a vegetarian, I'm sorry, I eat red meat. And I want to say I eat sometimes beef also. I'm from Kerala, and beef is actually, or the red meat is actually, but it has to be grass-fed or organic. That has reduced, actually, that is the most healing food if you want. That reduces the inflammation. And everybody say about the diet. I'm sorry, I'm not contradicting anything here. But you can research on it and you will be proved. Than a vegetarian, the meat, somebody, if you eat it, if you have more of stomach acid, like O blood group, B blood group, and all, not the A blood group I'm talking about. So it's again with the genetic and gender and your gut and all the conditions. So 90% of the population, or 80% of the population can eat red meat, and they can reduce the inflammation. That's what reduces the causes of any kind of diseases. So that's very important. And I know most of in India, actually 90% of the people are actually vegetarian. 1 billion people probably are vegetarian. Yeah, that's fine. That's their choice. And still there is plenty of good choices you can choose from. Now, I'm talking about 3S. Anybody can guess? Who's there? Okay, I don't want to wait. Now, all right. So first S everybody knows as a sugar. Second, as many people know that if you increase too much of salt, it increases the heart, blood pressure, and all of you know that reduce salt, reduce sodium, but you need sodium there. That's very important. And can you guess it, the third one? It is actually the starch. If you eat rice, it accelerates the blood sugar. It makes you uric acid. One of my manager, he has a uric acid, and he is actually, he is literally, the doctor told him to eat light. And within 6 months, this guy, he didn't even tell me, and I'm telling him, sir, now I got a grade 2 fatty liver. I didn't have anything. And I told him, what you are doing? My doctor told me just to don't eat the fat. And he was eating nicely fat. Only problem, he was eating sugar and sweets and now and then. And I told him what happened. He cannot even walk now. Then he got a fatty liver, and I told him, brother, you're eating light, kanji. When people get old, they give them kanji porridge with rice and water, South Indian people. Guys, this is a wrong thing. Reduce the starch. And as soon as I put him on a diet that is actually more of a veggies and protein and even lamb and meat, and he, within 2 months, reversed his fatty liver, higher protein, higher veggies, no sugar and no starch. So all this can actually help you as a nice drink. Okay, all right. So this is many people know that if you are following me, this is hydrogen water, and it has a power. I'll come up with the videos later. And listen here. It's actually, I'm going to drink a little bit. Yeah. All right. All right. I feel better. All right. So. Turn it on. Every time it turn it on, it actually produces 10,000 ppm of hydrogen and oxygen, and I'll explain to you later. So I hope you guys know that 3S, very important. What is the 3S? And the last S is I add, so sugar, salt, and starch plus your stress. That the fourth S is actually accelerate your heart disease. To be careful about this 4 S's and share it with your friends and family. Now the next one is, all you do is, we are actually into doing what? A blood type, DNA, gut, and your personal health condition. Based on that, Dr. Jaison prescribes certain things. So your blood type, your DNA, and your gut and everything is very important. Not a generic way, I eat healthy, I'm just doing some walking. It doesn't work for the heart. That's what I just wanted to tell you. One more time, I just wanted to make sure and make you understand. Many of the people comes to me and tell me that I have a fatty liver, and they say, no, I have grade 1. And I said, I done a blood test. A blood test won't actually precisely tell you what is when you have a fatty liver. You need to do a fibro scan. And I tell you the other test, you must have to do it later on this video. So people with a fatty liver, and liver is like a gatekeeper. If you every 1 minute the 1.5 to 2 liters of blood is coming to the liver, and the liver has to clean it up in a whole day. How many thousands of liters liver has to clean? And when you do a blood test, it doesn't do it. You need to do a fibro scan. Then you know it. And if you want to lose weight, if you want to improve your heart health, if you don't want to have a heart attack, don't listen to anyone. Be brisk. Make sure your liver doesn't have any fat, and you will have ample of health. This is my word. This is my experience. I'm telling you, don't listen to anybody. It's okay. Grade 1 is okay. Grade 2 is okay. Grade 3 fibrosis is okay. Or you want to wait for your cirrhosis to die. No, please don't do that. Just reverse your fatty liver. And within 3-4 weeks of you starting, you can start reversing it. And when you have PCOD, kids has PCOD, the fatty liver, and the women has PCOD, they have hormonal issues they have. And all of us have. And you must have to reverse one more time. I'm telling you, you have a fatty liver, higher the chance to have a heart disease, and reverse your fatty liver. Don't listen to anyone. That's my personal message to you. The next one is, one more time regarding a fibro scan. And plus, This is a very important information I'm going to share with you. One, I told you earlier that Dr. Blair told me that 200 is the cholesterol. Yes, cholesterol, if increases, the bad cholesterol increases, is not good for you. I will teach you something later in my big workshop, how you need to count that. Yes, now they say, okay, HDL has to be this. Yeah, definitely HDL has to be above 50, average for men and women, 40 and 50 and 60. The higher the HDL, H means what? High. And then that HDL is the one bringing or taking your cholesterol into the liver. So very important, you need to have more. When you eat oily food, which means oily fish and sardines and salmons and omega-3s and almonds and walnuts and all that help you to accelerate the heart health. Okay, but the most important thing is actually you need to be very careful. I just wanted to drink off this hydrogen water. Hydrogen water is amazing. When I'm almost feeling, because I've been talking for a long time, am I right? You need to turn it off and you need to drink. Turn it on. Guys, I'm just here for you to share some knowledge and things. Just don't be that, okay, I'm here to just lecture you something. Whatever I learn, I'm just trying to explain. That's all my job is here. One more thing I just wanted to tell you about. If you have done HDL, if you have done LDL, you must learn about VLDL. VLDL is what? HDL is a LDL, why when the doctors say you have more LDL, bad cholesterol, they think that is actually, it is going to, because it's a big guy. The cholesterol, if it's a big guy like LDL, and they think that it's going to clog the arteries, but actually what happened is, this is with the water soluble, it can push us off the arteries and maybe it can come out. But the problem with the VLDL, many people, when you do an HDL, LDL test, they don't do the VLDL on a total, only the total lipid profile test with an VLDL, it will say, and the doctors think this is actually a small thing, it's not going to think, that's why they don't ask you to do it maybe. Some of the good doctors ask, and what happens is, this guy is after the pandemic, it is binding bigger than this, then it get clogged, that they allow others. And they become a big and clog, and with the pandemic medicine, you get a higher chance. That's why, guys, these days, these young guys with a little extra weight, they're getting heart disease, one of that. So please pass this message, what you have learned today. Share to your friends and family, the beloved ones. Share this knowledge. Then you will not be missing someone who is your beloved ones. You don't have to cry. Very simple thing. We can improve anyone's health. Let me continue. What is exercise and walking? And I already told you about, we do a bespoke. Bespoke suit means Dr. Jaison buy a shirt or stitch a shirt based on his size. So that's why Dr. Jaison's program is, A stands for alkalinity, keeping your body into an acidic and alkaline balance, and the right kind of water health. Yeah, you understand? All right. And the second one is, the most important, your DNA and your gut is matter. So we do a tailor-make program, alkaline, blood type and balance, plus DNA and gut. We call it a bespoke, or the right kind of size, right fit. And that's what we do it. And that is why people get the most result. And the very beautiful thing that we used to have a product called Power Water that was an ionized alkaline water, and many of the people, my clients, 10,000s of people, actually 100,000 of people have bought that product and I'm still enjoying. Now this is a second version. It's a hydrogen water miracle, I would say. I call this is actually as a holy grail. Holy grail means what? Look at the beauty, and it can heal you. So we have programs in our clinics in Burjuman, Marina, Karaman, in Fujairah and Sports Bay and all, and Power Gym. We have a program that people come, then they can drink and live and breathe hydrogen, and actually then also they can take a bath. All that can, literally, indirectly, they can actually literally improve your overall health, including the heart health. So why don't you try, guys? This, can you eat 100 plus fruits and vegetables, and that exactly it's doing that much of antioxidant level in it. That's what many people don't understand when I talk about it. And when you breathe, it's only H2O is what? Hydrogen 2 and 1 oxygen. This is 10,000 ppm. Can you see the beautiful things is happening? So that is Dr. Jaison's Power Water. I would suggest and I would recommend, and because this is a higher quality version, because it has more of titanium and platinum plates, it's not the regular hydrogen bottle you find in the market, and it doesn't have that much of ppm. All this, if you come to my workshop, and whoever register, we are putting some numbers here. When we post this video, we'll put these numbers, and you can register for my next advanced workshop. And when you join in this workshop, it's only limited seats, 20 to 30 only we take it, and out of that 20 people, you will be entitled to have one. It's not just a lucky draw, all of you will have. So please, just drop your name and number and send the information and enquiry, and how we'll teach you how all this information. If you want to lose weight, get fit, improve your health, cardiovascular, even a person is already put. I put to forget a slide, very, very important, that these days, and a lot of doctors are making money actually. Sorry to say, that is a system. I have seen a guy who's been having several blocks living for years. Do you know that if you have a block, suddenly when you go there and you have a heart blocked, and it's not only one artery you have, okay? So sometimes there is a block, not certain things I'm talking about. The doctors ask you to just go for a cleanup or put a stent. They have to put a stent here. You have to pay 100,000, 200,000, 1 lakh, 2 lakh. You have to invest money. And what is actually literally they doing when they clean up, the residual is going into the blood. Most of the people done a heart surgery, they die after a few years. Many people don't know about this. And if you have a block, you're going to die sometimes. Not all the time. I'm talking about people who live in the mountain. They have a heart block. I have researched and I've seen some of the studies. The people who live in the mountain is altitude, like actor Mohanlal recently went to shoot one of the movie in a high altitude, and he said, Jason, I couldn't even go outside because I couldn't breathe for 3 days. So people who lives there, they don't get it, and they can move. Why? Because the altitude, and because they're not able to push the blood, all the arteries, so they get a couple of blocks. That's what unbelievable story I've seen. So if there is a block, people are just making medicine. So it's not to worry about a block. To improve your cardiovascular health and to making the big pipe is very important. I'm telling you guys. So I just wanted to conclude. Next 5 minutes is very important. If you're staying fasting, actually can do. If you do fasting with hydrogen water, it's a miracle, and you can heal. Sometimes I do a 1-day fasting to a 3-day water fasting. But when you do a water fasting, many people do fasting these days, you must drink the right kind of water, because you need to have a higher minerals, higher antioxidants, then only body can absorb that water. It has to be microclustering, it has to be alkalinity, it has to be antioxidants. ORP, oxidation reduction potential, is actually antioxidants. So that is, you need to have it, and then only body, that right kind of water you get it. That's what is the hydrogen water. So if you are fasting, get the right kind, higher mineral water is very important. Body has more than 16 minerals in body. I'll tell you about the next slide when it comes to it, and very important to prevent heart attack. That's one important thing I'll tell you, and I conclude with the matter. So to heal you, you can. Hydrogen water is an amazing product. Now I want to tell you, even cancer eat 8 times. Cancer. And regular cells only eat 1 time. So reducing the food also actually increasing the health of heart. Prevention of a heart attack, I can say. You can increase the circulation, improve the overall health. So all this in my big workshop, you can join soon. So we have some shockers for the body. Fasting is one of the shockers. There are 2-3 shockers for the brain, and that improve your overall health. In my full workshop, you can learn how you can shock. I'll give you one more clue. It's a cold plunge. Cold plunge is the ice shower. When you have an ice shower, it's it's exactly your body freezes, and you cannot anymore send oxygen, and that shock the brain. And that is, the brain only. And when you work, you work and you rest. Actually, what happens? Your body getting enough, but your brain is not literally getting any fuel. When you eat, you walk, you're getting fuel, but brain is not getting any fuel. Brain is getting fuel when you shock. That's why you need to have a shockers. And I'll tell you more shockers for you. You will not be eye-opener. So when you shock, in Body Perfect Holistic Center Marina, we have shockers now. You can go and do a cold plunge and hydrogen bath and a hot and all that kind of facility. In Sports Bay, we're going to have in Marina Karama, all the Fijera, all the branches we're going to have. If you are in Dubai, come and enjoy and learn that shockers and how to improve your overall health and enjoy the hydrogen water, power water, miracle water, and healing water, holy grail, I would say, and you enjoy it. And the last couple of slides to finish, and very important is, I would suggest to you, many people actually you've seen in, they playing, when they play badminton, they get faint, or they just run on the treadmill, they faint. One of the famous actor recently died, and they all blame exercise, don't exercise, and then you get out. Guys, it's not. I have given you all the information. Somebody is actually overweight. They have a cholesterol. Their heart is unhealthy. And if they are fat and they're not able to go and do anything, and suddenly they go on physical activity, it might. And there is one thing, every time you exercise, what happens? You lose a lot of magnesium. If I do a contraction, I lose magnesium. Magnesium is a mineral. I told you 16 essential minerals you need in your body to maintain the body. And if you have just the trace minerals or the minerals or essential minerals, one magnesium, if it's deficient, all you running and walking and eating and everything, when you do contract the muscles and you have only that trace minerals, one is magnesium missing, what will happen? Your heart is contracted, it's not releasing back, you get a heart attack. You know in Japan what they do when the people get a heart attack? I heard they take a magnesium syringe in the ambulance before they go to the doctor. They pour into the heart and they give actually going to give them a pork into it. So a lot of things I'm going to give you information, and mainly all these things I'll explain to you all in my big workshop. So I want you to come into it. I will be sharing you the dates and details. Whoever wanted interested, please send you all that information. And it's your life. Do not play. If you are not fit, don't play a game. I would say don't play badminton if you're not fit. Get fit. I will teach you. If you're not fat, you don't do it. Finally, the last thing why people faint, I already told you, and take action and take away the past message to you as your friends and family. Life is important. One life you have, and if you don't want to miss anyone, keep your heart healthy. And very simple thing, conclusion is, take away messages, do a HDL, LDL, VLDL test and a fibrosis test, and which is FibroScan. Do it today if you are above 30. And if you want any more information, leave a name and number and a message. We'll get back to you. And thank you very much for listening. Please follow me in Dr. Jaison Instagram, YouTube, Facebook, TikTok, and send you or walk in, and we will be there for you. My team, we have hundreds of people and doctors and DHA qualified doctors and dietitians are there. They'll all help you. You have one heart to look after. So do some action today. And thank you. Good night.